Hello, my name is Dr. Rosa Gomez. I'm a primary care provider of family medicine here in Palmdale, California. I am making this video to inform my patients and the community of what they should know in the case that they develop symptoms. It is important to recognize that there were projections that were recently made that suggested that the peak of infection here in the U.S. would be about mid-April, and that in mid-May the number of cases would start decreasing significantly, and we all hope that that's the case. Remember, the number of infections that occur in our communities depend on how well we are staying isolated from each other. So do everything you can to stay indoors. In doing so, you're going to decrease the number of infected persons that show up at the hospital all at once, and you will improve your hospital's ability to deal with all of these sick people, and all of the medical professionals will thank you. I thank you now. Please stay indoors. Okay, so in the case that you have symptoms, you need to know the symptoms first. And the first one is, if you have a fever of 100.4 Fahrenheit or 38 degrees Celsius, that is an official fever. That or anything above it, official fever. Also, shortness of breath, severe fatigue, diarrhea, vomiting, any of those things should be reported to your doctor. And that's what I want to emphasize. If you have symptoms, you should contact your doctor first. The urgent cares in the area currently are not seeing patients with symptoms in person. They're offering telehealth visits, and they're offering telephone visits. As far as our office is concerned, we're also offering the same thing. Please call us first. We can guide you. We can let you know what we should suggest. If people need further evaluation beyond the telehealth visit, then they are being sent directly to the hospital. Keep in mind, if you don't need to go to the hospital, don't go to the hospital. If you don't have the coronavirus already, then if you go there, you're at great risk for getting it. So utilize your doctor's offices. In most cases, when people call our office and tell us that they have fevers, that they have shortness of breath or severe fatigue, we advise them to do the following. Make sure that you stay quarantined for 14 days at least. If you are the sole provider in the house, you need to go out and work, whatever it may be. You might be able to go out sooner than that, but it's all on a case-by-case basis, and you really need to speak to your doctor. The importance of 14 days. From now on, if anybody gets symptoms, we have to assume the worst. You may just have a regular cold, or maybe you do have the flu, or maybe it is the coronavirus. But whichever it is, because of the limited testing that has been out there, we need to conclude that it is the coronavirus, and that you need to isolate yourself from everyone else, including the people in your home. So if you're ill, you need to stay in your home. Try to stay within your own room if you can. If there's a bathroom associated with that room, that would be best, and stay in that area. If you need to leave that room, you need to wear a mask and limit exiting out of that room. The more isolated you are, the better. No one else should be sleeping there either. If anybody goes in to clean that room, they also need to be wearing masks. Everyone in the house needs to be washing their hands regularly. If anybody sneezes, sneeze into your elbow. Don't touch your face. And disinfect all of the frequently touched surfaces. All of these things can really help people within the home not to get the infection. Discourage anyone from coming to visit you. Even if you're not sick, discourage people from coming into your home. Now, if for the person who is sick, the things that we need to do for them and do for ourselves is to make sure to get a lot of rest. A lot of people have very high fevers. It really tires them out. You need to make sure that you're well hydrated. So drink a whole lot of fluids. There's been talk about whether it's safe to take ibuprofen. The truth is that the data is not, scientific data isn't really clear, but we would recommend that you take Tylenol for fever control and for achy bodies and symptoms that you may have. Also, if you have children who are younger, please don't give them, if you have children that are younger than age 2, be careful what you give them. Tylenol is fine, but cough and cold medication, you should really check with your doctor. And Tylenol is not a cure for the virus. It's only meant to help you with the symptoms. So it's not going to make you get better faster. Your body needs to be the one to get better faster. So rest, fluids, and try to eat. You need to eat. Otherwise, your body really won't be able to recover as well. Signs that tell you that you need to go to the hospital. If you feel that you take a deep breath and the air is not really going in, even when you breathe through your mouth, that's a bad sign. Then you need to go to the hospital. If you can't keep fluids down because you have so much nausea, you have to go to the hospital. In that case, you might become dehydrated. That would be very bad for all the other organs in your body. Then you would have to go to the hospital. If you start being very confused, keep an eye on your loved ones. That would be a bad sign and you would have to go to the hospital. Or any other serious symptoms that really concern you, please, then you would have to go to the hospital. In those cases, you don't have another choice. But in general, like I said, try to avoid the hospital in the beginning. I think that's it for now. I hope to make more videos with more information, and stay safe. We all wish everyone the best. Thank you.